Thank you everyone for being here today. My name is Heather Crate. I'm the Education Liaison Officer for our K-12 settings at Boulder County Public Health. Today we are going to be going over the updates to the Colorado Department of Public Health and Environment's case and outbreaks guidance for K-12 schools. This guidance also extends to childcare settings, but today we're going to be specifically focusing on the K-12 setting. First off, I wanted to make sure that you all were aware of your Boulder County education team here at Public Health. We have grown quite a bit in just the last few weeks. For our mitigation specialists, we have myself, Heather Crate, as the lead liaison. Allison Bailey has been helping us for quite a while now. And then Marcy Campbell is newer to our team over the last few weeks. So those are the folks who are going to help answer your general questions around education settings, cohorting, cleaning, disinfecting, all of those pieces. And then in our epidemiology support, we have Soda Sonata, who many of you have worked with, who is our lead for the epi support, Rachel Geller, Taylor Carranza, and Naomi Mendoza, who are all helping with the case and contact investigation. We also wanted to let you all know that Naomi is our Spanish-speaking lead, and we are hopefully going to be adding another epi support who is Spanish-speaking as well for support with Spanish-speaking families. Many of you are likely already aware of this, but for your general education questions, you're going to want to reach out to education@bouldercounty.org. And for your epi-related questions, we have the COVID-19 epi line at bouldercounty.org. And our voicemail that you can call and leave a voicemail for the epi team to get back to you. It's helpful in that voicemail if you do let the team know that this is a K-12 related call. Okay, so as I said, as we go along, please remain muted. If you have questions as they come up, enter them into the chat, and we'll be allowing some time for question and answer at the end. And we'll be sharing out this recording. Any questions that we don't get to, we will email out to everyone so that you have them in writing as well. So the first tool that we're going to be starting with is our at-home symptom screening tool. And Rachel Geller is going to take us through that tool.
Awesome. Hi, everybody. My name is Rachel. I'm going to be helping with the case and contact investigations for K-12. So we just wanted to briefly walk through the symptom screening tool that I'm sure a lot of you are already familiar with. This is for school staff and for students, so that's important to point out. Right now, the symptom screen is if you're experiencing any of the following, it's important to stay home, inform the school, and then we follow the return to learn guidance. A couple pieces as we kind of go through with return to learn and the symptom screen. If someone has had an exposure to COVID-19, they'll already be out. So all of these pieces are for someone who's having a new symptom or a change in their usual symptoms. So any one of these things should screen somebody out.
Great, thank you, Rachel. The next tool that we're going to be going over is if a child or staff feels or appears unwell after arriving at school. And Taylor Carranza is going to take us through that tool.
Hi, everyone. Taylor Carranza, also on the EPI team working on contact investigation. And this tool has been simplified from previous iterations. As Rachel said, it's really important to remember that this tool is only for students or staff that are not currently under quarantine or isolation for COVID-19. So these are for new potential cases or new potential symptoms. One of the things that you will see across these new tools is the elevation of the critical symptom of loss of taste or smell. And this is the first place that we see that screens somebody out sooner in the process. So at the very top here, Heather, if you wouldn't mind going to the next slide. Thank you. you can see that it says, does the individual have new loss of taste or smell of any duration? It is important to recognize that this is loss of taste or smell that is not affiliated with congestion. So there will be some additional, I think, guidance coming from the state to help screen that. But in particular, that is a key piece. So if anybody does have loss of taste or smell for any duration not affiliated with congestion, that's an automatic screen out when somebody is at school. And then the next tier is, does a person have any major or minor symptoms listed above? So you can see that they have those split out between major and minor symptoms. If you could give me the next slide, thank you. From there, if a person does not have any of those major or minor symptoms, they can return to class following the routine illness care, and returning to class if appropriate. If that person does have symptoms, this tool has been simplified from the previous version to make it a little bit clearer that these symptoms need to be unchanged from that person's baseline if they have a chronic condition, to allow it a little bit easier for nursing staff to differentiate between students who have asthma or allergies or other chronic conditions, so that they can make that differentiation. And then over on the left, you can also see that there's been a simplification from the previous version, where school staff no longer has to differentiate based off of the community transmission level, and instead just has one way of deciding if students are going home or not, over here on the left. So those are those major changes for this tool.
Thank you, Taylor.
Thank you.
All right, so next up, we are going to talk through the Return to Learn tool, and Rachel Geller is going to talk through this. Okay.
Great. So one thing that I want to mention first with this Return to Learn piece is we actually have 3 documents depending on where Boulder County is on that dial. So the one that we have in this presentation is for level 1 or level 2, since we're currently at level 2. And I'll walk through this one and then make a couple of notes of things to look for in those other 2 documents, but I would advise look through all 3 of them, but this one is the most important for us right now. As Taylor mentioned, so this is another place where we see that smell for any duration. And so right away, if someone does have new loss of taste or smell, if that persists, they should, so if they have any duration, then they should follow home isolation. For other symptoms, if they go away in 24 hours, then you can follow return to school illness policies for regular types of illness. And I think the next line might have this piece zoomed in a little bit more. Thanks, Heather. And so if 24 hours go by, those symptoms are gone, you can follow regular return to school guidance. If they have minor symptoms only, and so you can see those minor and major symptoms broken out at the bottom of this document too. If they are only minor symptoms and they resolve in 48 hours and the person can safely wear a mask.
Heather, I feel like she's cutting in and out. Are you feeling the same?
Okay. Rachel.
They're able to return to school. Oops, hey everybody, are you able to hear me a little bit better now? I apologize.
Yeah, you were cutting in and out. I'm sorry, I didn't know if it was just me.
I'm sorry, I didn't realize. Is this a little bit better?
Yes.
Okay.
Can you start at the top of this last slide for us, please?
Yeah, absolutely. Thanks, John. So at the top of this, as Taylor mentioned, we have this new heightening of loss of taste or smell, which immediately brings someone into that 10 days out. If they have symptoms that resolve within 24 hours, that person is able to return to school following regular return to school illness policies. However, if that person has minor symptoms only, if the person has minor symptoms only, if they resolve in 48 hours and that person can safely wear a mask, they can also follow those regular return to learn guidelines. The important piece here is, again, that distinction between major and minor symptoms, which you can also find at the bottom of this document. Okay.
Apologies on the sound, everyone. It's okay. It's just a little choppy, Rachel.
a little choppy. I'm sorry, everybody. And then for the second part, so if someone's symptoms do not resolve in 48 hours, they'll need to get a PCR test. If that test is negative and the person can safely wear a mask, they're able to follow regular return to school policies, or of course, if that test is positive, follow.
Heather, maybe if Rachel killed her video,
Yeah.
you'd have a better.
I just muted you, Rachel, for a second. Apologies for that, folks. Rachel, you want to go ahead and unmute yourself, or we can hand it over to someone else to talk through.
Yeah, I'm so sorry, everybody. Thank you for your patience. Hopefully this is a little bit better. If not, Heather, go ahead and mute me. For the second half of this document, if someone's symptoms do not resolve in 48 hours, they need to get a PCR test. If that testing is done and the result is negative and someone can wear a mask safely, they're able to follow that regular return to school illness policies. If testing is not done, or of course, if that test is positive, they need to follow home isolation for 10 days. One big distinction in this document from from Safer at Home Level 3 is that you also, in addition to that negative test, also need to have a alternate diagnosis from a medical provider, and CDPHE has provided some templates for providers to be able to support folks in that alternate diagnosis.
Thank you, Rachel. That was much clearer. Okay, so we're going to move on to the next tool. I know I see some questions coming in. We will try and get through those at the end. We just want to do the walkthroughs of the tools now. So we are going to go through the what happens to the contacts tool, and Soda is going to walk us through that.
Okay, so I don't know what people are going to be hearing on your end. I'm hoping I'm not choppy, and I turned off my video to spare you guys, and also to try to make sure that the sound is going to be okay. So the last few documents were actually about what happens to the person who's symptomatic or tests positive. This is going to be about what happens with the contacts. And so this is for contacts who either test positive or close contacts of somebody who's a positive, who have symptoms, either critical or non-critical, major or minor symptoms, and what to do. And it's an easy flow because it reads like a traffic light. So red means that you will have to dismiss contacts from school immediately. Yellow is you have a little bit of time and let's tease this out. And green is when people come back. So next slide, please. So what happens to the contacts? And contacts in this situation are going to be any close contacts of students or staff or teachers, a cohort, which could be maybe an after-school program, or a classroom, which could be if somebody is changing classes a lot, it could be every single classroom. And we'll be talking about that as well. Okay, next slide. So, oh, I thought this was going to go out. But so the green is really going to be what we want to get to from each section, whether red or yellow. We want to be following the criteria for the contacts to return. When the person who is sick or has tested positive has met the return to school criteria, the contacts, the cohorts, the classrooms can return to in-person learning, or if they can't be met, 14 days have to pass since the last time the cohorts, close contacts, or classes have seen this student. They have to be out until 14 days have passed. Next slide, please. Next slide. Okay, sorry. So this is the red. This is the easy one. If the person, student or staff or teacher was sent home because they had a positive COVID-19 test, you have to dismiss the contacts from the school immediately. The case has to be isolated for 10 full days from the symptom onset or from the date the test was done if they were not symptomatic. And then the cohort, class, or close contacts have to quarantine for 14 days from the last known contact with the positive COVID case. What happens if there's a close contact of a positive COVID case? It's a quarantine for 14 days from last known contact, whether or not the contact has a negative test or not. So the next, let's see. What brings the students back? 14 days have passed. Negative PCR test did not change the quarantine period. Some people have wanted to know what happens if somebody had a confirmed COVID diagnosis recently, and that's going to be an individual determination, and you'll have to give us a call. So the other parts of the red are, what if you have new onset symptoms and you've had a close contact with a COVID case? That is a person who would likely meet the definition of a probable case even without a test result. And the class, cohort, or contacts need to be dismissed immediately for 14 days. So that's an epi link, as well as a major symptom or an epi-link and 2 minor symptoms, or an epi-link and you've lost your sense of taste and smell. So what brings the class back? Nothing. They're really out for 14 days. No negative test will bring them back. And then the new one on here is that critical symptom of new loss of taste and smell. And that seems to be the thing that maybe really related with several of our COVID positive cases. If anybody reports this and it's not related to congestion, you have to dismiss the class, cohorts, and close contacts, and they have to quarantine for 14 days. Okay, so now the next box is the yellow box. Can I get the next? Yeah, okay. So this one's a little bit more complicated and needs a little bit of teasing out. Remember that this yellow box does not pertain to any of the close contacts with a COVID case. So if nothing in the red box was marked yes, if the individual has 1 or more major symptom, if they have 2 or more minor symptoms, or if 10% of the class is out with COVID-19 symptoms, if any of those things are a yes, the class, the cohorts, the close contacts can stay in school as long as there's no known close contact with a confirmed positive for the person who's sick. And they can stay in school for the first 4 days, giving that person time to recover according to how they return via the Return to Learn guidance document. And if it takes longer to get a test back, say they're taking more than 48 hours to recover from their symptoms, then the class may need to leave after 4 days in order to wait for that test result to come back. And if the test result comes back positive, they are out for 10 more days. If the test comes back negative, they can return to class or to in-person work or class. So what was the next slide? Next slide, okay. Here's an example. I was going to put in a couple examples. This one is, if person A has a household contact with COVID, is asymptomatic, tests positive on the 1st of October, if someone shares the office with person A and develops symptoms on 10/3, the last contact with person A is on 10/3, what do you do with person B? You quarantine, you isolate, because they've developed 3 symptoms that are on that list. They had a known contact, they share an office with person A, so they need to be isolated until the 13th, return to work on the 14th. So this is a staff example. What if person B had a meeting with another group on the 2nd at the same school? Person B is a probable case, and whether or not person B tests negative or positive, group B must quarantine from the last time they saw person B until the 16th of October. What if person A had a meeting with person C and C develops symptoms and also had a group meeting with their own group the day before? Person C is also considered a probable case, and you have to quarantine group C as well as isolate that person C. So next slide. Student is a 6-year-old. The student's mom tests positive for COVID. When will you quarantine student A who is 6 years old? So this is an example that comes up fairly often. I think a lot of times that people, we'll go ahead and answer that question later. I think a lot of times when people have really young students, it's really difficult for a young student to separate from their mom for the requisite amount of time for the mom to become non-infectious. So for those kinds of situations, the end of mom's isolation period is 10/10. You would start student A's quarantine period then if they were unable to effectively separate from the mom for 14 days. And you would quarantine until the 24th of October, and they can return on the 25th. What if student A has a sullen teenage sister that stays in their room constantly? They may be able to effectively quarantine away from their parent, and so you can release the sister 14 days from the last contact with the mom. So, okay, that's it.
Thank you, Soda. Helpful to walk through those examples. I know we've got a lot of questions coming in, and again, we'll get to those at the end if you just want to put those in the chat. Next, we are going to talk through a new tool that was put out with the guidance called Who is a Close Contact? And Taylor Carranza is going to talk us through that tool.
So as Heather said, this is a new tool that we did not have previous. It is an opportunity for school districts and schools that can meet this criteria to perform a little bit more targeted contact tracing for determining who is a close contact. The recommendation, next slide, please. What's really important about this, though, is that the recommendation is still that the most effective mechanism to limit potential disease transmission is cohorting, and particularly small cohorts. That targeted contact tracing is going to most likely be effective in middle and high school settings, most feasible. That it is unlikely to be able to perform any type of targeted contact tracing with those younger grades, just due to the nature of the development of younger kids and the likelihood of them being able to sit still is a large piece of that. Other components of this targeted tool are that this allows for contact tracing within the contagious period. It's not just from the positive test date, so you have to be able to account for all movements of the students for 2 days previous to that positive test or that onset of symptoms. So there's going to be several days that you have to be able to account for all movements of that student in order to qualify for targeted contact tracing. That all the time-based criteria that you see on this document is cumulative, and that schools are going to be encouraged and required to complete a contact tracing drill before adopting this strategy. Next slide, please. So what is the criteria that a school has to meet to be able to perform targeted contact tracing? It is that this is only applicable in Protect Our Neighbors, Safer at Home levels 1 and 2. So currently Boulder County is eligible, but if that changes, this will not be an option. It is only one student or staff member in a class that currently has a symptom. So as soon as you have that second case or symptomatic, that changes the ability to do this, and we're going to be looking at a cohort exclusion model or potentially outbreaks. The administrative capacity. So this is about the school itself, school and district. Is there a plan to actually track and respond to illnesses and absences in school? Does every class attended by the student have a seating chart? Can you verify that students were remaining within their seats during the time of class? So that's where those younger students are less likely to apply here. And is there a plan to perform contact tracing in conjunction with local public health? So we need to have coordination between school districts and public health, but just a reminder that this administrative capacity and the ability to track down this information needs to be at the school level. And then what steps have been taken to minimize risk, transmission risk? Is there screenings that's performed every day for all student and staff? Do the affected student staff wear masks at all times? Can you verify that? Was there steps to reduce likelihood of transmission? There's some examples for meals in particular, lunch outside, staggered meal time, increased spacing during meals. And did that student or staff refrain from activities such as singing, playing, vigorous sports, outdoor exercise, things that increase the likelihood of spread through breath? Next slide, please. So if you can say yes to all of those things, and this can be done in a short amount of time. So if this is if a student informs a school that they have tested positive for COVID-19 at 4 p.m., this needs to be able to be conducted in time to notify all close contacts for the next school day. So that is a major component in this. Then there is space for discretion for targeted contact tracing, which would mean that close contacts would only count as students or as other people who are within 6 feet of that individual for 15 minutes or greater when both parties are wearing a mask, or individuals that were within 12 feet of that person for more than 15 minutes, or for 15 minutes or greater when they were unmasked, such as meal times, which would be the only time, as that is a prerequisite above, that they had to wear masks the whole time. If all of those criteria cannot be met, exclusion contacts would count as both of those groups, as well as anybody who is in a classroom with that individual for 40 minutes or greater. So that would return back to the entire classroom and cohort model. I know that's a lot of information, and we'll be answering questions at the end. This is the newest tool, but we really wanted to be super clear about that it's an all or nothing criteria in this. Thank you.
Thank you, Taylor. So now we are going to open it up to question and answers. Please do stay muted. We're going to go through the chat, and Allison is going to help us out with that piece. Allison, do you want to put out our first question?
So one question that's come up a few times in the questions we got ahead of time and today is about the return to learn document. There's no requirement for alternative diagnosis in some of the stages. And so wondering if someone could talk through the reasoning for that and reiterate what stages you do need an alternative diagnosis.
You want me to take that piece since I walked through return to learn? How is
Sure.
my audio?
It sounds good now. Yep.
All right, we will keep video off. So I'm going to walk through. I realized one piece too that I just wanted to add because I saw it in the questions that I didn't chat out in those return to learn documents. As you'll notice in that final bubble, if someone fits all of the above criteria to return to learn following regular illness policies, symptoms need to be resolved for 24 hours. So that little bullet is in there. But for those different phases, so I'll talk through the alternate diagnosis piece at each level. So basically, as you go into more restrictive levels, the conservativeness of return to learn has to do with how wide community spread is. So in Protect Your Neighbors, if someone does not have a PCR test, so they didn't go to get tested or that result is pending, but they have an alternate diagnosis that explains all of their symptoms, they can wear a mask safely, and all symptoms have resolved for 24 hours, then that alternate diagnosis alone in Protect Your Neighbors could potentially get someone back before the 10 days. Then we move to the one that I was presenting on, so Safer at Home 1 or 2. So if someone does not get a PCR test, but they've had symptoms that didn't go away in 48 hours, they're going to be out for 10 days. So that alternative diagnosis is not going to be enough if they didn't go to get a COVID-19 PCR test. In Safer at Home 1 or 2, if they get a PCR test, that test is negative, they can wear a mask safely, symptoms stay resolved for 24 hours, that person could potentially return sooner than the 10 days. So in that case, they have the PCR negative. They don't additionally need an alternate diagnosis on top of that negative. What changes when we go into safer at home level 3, same with no PCR, they're going to be out for 10, an alternate diagnosis is not enough. But at safer at home level 3, in order to get back potentially sooner than 10 days, someone's going to need that PCR negative and an alternate diagnosis, plus being able to wear a mask safely and 24 hours of symptoms resolved. So when we get to level 3, that's where we need negative and an alternate diagnosis.
Thank you,
Hopefully
Rachel.
that's helpful, yeah. Of course.
I think, Rachel, one question that has come up is if the alternate diagnosis doesn't explain all the symptoms, does that mean that they can't go back?
So my understanding is for protect your neighbors and that safer at home level 3, where an alternate diagnosis can come into the mix. What it says in that box is it has to explain all symptoms. So if it doesn't, it would put someone out for 10 days. And anyone else can add on to that if they have other thoughts.
The tool web link also has sample healthcare provider letters that can help guide healthcare providers on what sorts of things that the state health department might be looking for as far as alternative diagnoses.
Thank you, Soda. All right, Allison, next question.
So another question that's come in is in the return to learn guidance that schools need to be collecting PCR test results. But in another place in the outbreak guidance, it says that a negative test does not clear someone. I'm wondering if someone could be able to explain the role of a negative test result.
All right, who would like to take that?
Who?
Go ahead, Soda.
So for people who are close contacts of confirmed COVID cases, a negative test does not bring them back sooner. And that's hard and fast. Is there a particular type of situation that people are looking for otherwise? In the return to learn guidance, if we're in level 1 or 2, a negative test result can bring you back sooner as long as you are not a close contact for a COVID case.
Anybody else want to add on to that? I think it's just the clarification that that negative test is for someone who was symptomatic based on the criteria, not someone who was a close contact. All right, next question.
A quick question from John. Can you clarify 10 days? Is it 10 school days or 10 calendar days?
10 calendar days. So what that return to learn guidance is pointing to is we're treating that person as if they had COVID, and we're giving them a 10-day isolation period. So if someone tests positive for COVID, their isolation period is 10 days as long as they meet the recovery criteria. And so that's where that 10 calendar days comes from.
Thank you. Allison or Marcy, next question.
We've got a few questions on the what happens to the contacts chart, or the stoplight chart, as some of us have started calling it. In the yellow zone, some explanation around the first 4 days out, that a student is out, that there's no school action with the contacts, but on the 5th day, a cohort becomes remote. And so the question is clarifying that, and then also at what point would schools be working with Boulder County Public Health on the extent of the quarantine and making some of those decisions?
We would love to be working closely with any school that is having difficulty with this. And the answer is yes, that after those 4 days have passed and we have not received either a negative test result or, in different circumstances, a different diagnosis, or the person who's sick has not resolved all of their symptoms, then yes, they are taking out of out of in-person learning or work.
Thank you, Soda.
Thank you. The provider, another question around our negative test in 10 days, clarifying questions. The provider letter says a negative test would not shorten isolation, but if a person is out for symptoms but tests negative, would they be allowed back earlier than 10 days?
As long as they are not a close contact of a known case.
And that those symptoms are just minor symptoms. So if that person has major symptoms, and so you can clarify this too, but potentially if they meet, so if they have an exposure, and then they'd be called a probable case if they fit our clinical criteria. But if it's somebody who just is symptomatic, no link to someone who's tested positive, and only has minor symptoms and correct and safer at home 1 or 2, that they could be back earlier than 10 days.
Mm-hmm.
And to clarify, that line about isolation is in reference to somebody who is in isolation for either being a confirmed case or a probable case. So that person either has an epi link or has already gotten a positive test and is got another negative test or something like that. That's what would shorten their isolation time.
Thank you all. Next question from the chat.
On that same vein, return to learn safer at home level 2. If a person has symptoms and tests positive for strep, do they still need a negative PCR since this would be an alternative diagnosis?
So at level 2, we need that PCR negative. So unfortunately, it's not one or the other. We would still need to see the negative PCR even if they had that alternate diagnosis.
Thanks, Rachel. Next question.
So on a question on the close contact form, if a teacher is in a classroom for more than 40 minutes, does this mean the teacher is quarantined? This question thinking about a specials teacher, so maybe an art or a music teacher, and wondering if they need to keep their contact time with classes to less than 40 minutes.
My understanding is yes, if they are in the room for more than 40 minutes and there's not an ability to meet all the criteria for a targeted contact identification, that teacher would be quarantined. Soda, do you have anything to add to that?
No, and that is something that could get teased out if a school has the ability to do contact tracing, but that generally is something that is considered a long enough exposure, especially in enclosed areas.
Thank you both.
Similar question around close contacts. What about outside activities and determination of close contacts? Is there any change if the contacts are happening outside rather than inside?
One of the key things that I think I didn't mention super clearly was that 12 feet for an individual, 12 feet for individuals people are within 12 feet from 15 minutes or more unmasked, and indoors is the only time that comes into play. People who are within 6 feet, it does not matter if they're indoors or outdoors. So that 15-minute period within 6 feet, both wearing masks. Obviously, if they're unmasked as well, that 6 feet distance, it doesn't matter indoor or outdoors. Is that the question, Allison, or is there more to that?
Yeah, I believe that was the question. If not, feel free to ask it again in the chat if we missed that. But that's like a common question about what may be different about indoors or outdoors. Thank you.
All right, another question from the chat. I know we've got a ton coming in, so we're working on getting some of those.
I misspoke.
Go ahead, Soda.
Yeah, I misspoke. So for the standard contact identification, if they actually were in the classroom for 40 minutes, the entire classroom would be out. I misspoke.
Thank you, Soda. Yeah, so it's only if they're able to meet all the criteria for that additional contact tracing for being able to delineate some of that.
And I think we had a clarifying question about if there's a length of time for outdoor exposure with a mask and within 6 to 12 feet.
So within 6 feet, it's 15 minutes, indoor or outdoor. And then outdoor, it's if they're past 6 feet, that doesn't impact. Can we repeat that one more time, Marcy? I'm sorry.
Sure, sorry, I'm slow to the unmute. Is there a length of time for outdoor exposure with a mask and within 6 to 12 feet?
No, just that 6 feet, 15 minutes, indoor or outdoor, as far as I'm aware. Soda, do you have anything to add to that?
No, sorry, I hadn't muted before, but no.
Thank you. I had a question about the timing of testing. Does it matter when the test is conducted? If a classroom has a case, how soon should the close contacts be tested?
So is it okay if I take that one? So when you're testing, one of the things that people need to know is if you test too soon, you can test negative, and it would be a false negative. The time for the least or the lowest probability of a false negative test is right around 7 to 8 days from the point of contact, with the COVID positive individual. But that risk is still somewhere around 20%, which is high, which means that, up to 1 in 5 tests that come up negative may be falsely negative. So you don't want to test too soon. And right around that 7 to 8 day period would be a good time. If you test, we definitely now have a leg up in public health on getting contacts out of circulation before they start to infect others.
One question that I've seen in the chat, because I think it's documented in more of the tools in this new iteration, is wearing a mask safely. Do we have clarification on what constitutes whether or not someone's able to wear a mask safely? Anybody want to take that?
Soda, I think that you might be able to speak a little better to this, but my understanding is there might be somebody has a disability that affects them from being able to wear a mask safely. If they have a breathing tube or something else like that. Age might come into play, as well as anybody who is concerned about their ability to breathe shouldn't be wearing a mask. And most of the time, if that's related to a COVID symptom, they shouldn't be returning anyway. But that is, I'm sure Soda has more to add to that.
It's important that people who are wearing masks, no matter what age, are able to take their masks off and put them on independently, that they are able to do that. And for those people who cannot wear a mask either due to a disability or a medical reason, the schools try awfully, awfully hard to be able to accommodate in any other way for learning to take place. Oh, and can I just say, it's really wrong to wear a mask and it doesn't cover your nose. I mean, it has to cover your nose.
Yes, definitely need to cover the nose and mouth. Thank you. Thank you all. All right.
A question. Oh, sorry.
No, go ahead. Next question.
A persistent cough and new or worsening cough is used on some different tools. Could you all give a description of a cough that would meet that definition, or talk through how someone would know that something was a persistent cough and new or worsening cough?
If anybody wants to take that, or I could. A lot of times people who have asthma have a sort of a dry cough that usually doesn't come in paroxysms, like they're not having fits of coughing. They usually don't feel terribly sick. They may be short of breath, or they may be having sort of a clearing of throat kind of cough. So it's like, and it sounds like that, and it goes on annoyingly for like the entire day. So, and I have asthma, so I feel like I can say that. It's totally annoying. But if they begin to have something that's really a much more, a deeper cough, they could have a productive cough with this. Oftentimes it's a dry cough. Oftentimes it's a cough that people really can't control, that isn't alleviated well by taking a sip of water. Those things you want to be paying attention to, especially if it comes about with other types of symptoms. So symptoms that might signal a viral infection would be if you feel achy, or if you have a fever, if you have a headache. You know, some of these other types of symptoms that comes along with COVID would be a signal that this person is not just having their normal GERD-related cough or asthma-related cough. If they're outside and they come in and their cough gets better, maybe it's due to the smoke. But people need to tease some of that out and know what the student or the teachers or the staff members baseline. What is that baseline, and how is it different?
And just to add to that, as Soto said, that baseline piece is really important. And I think that's why we saw a change in language in this tool versus the previous iteration, where now it's really just saying new or worsening cough, as opposed to having to determine persistent. That's been removed for the most part. So that baseline is now what you should be basing it off of.
Thank you.
So we've gotten a few questions around the 24 hours. So if a student had symptoms on a Sunday, was totally symptom-free on a Monday, is the earliest they can return Tuesday so that they're symptom-free for 24 hours? You could answer that and then maybe talk through a little bit of the 24-48 pieces around thinking through symptoms.
So I can take a piece of that. So to clarify at this time, so we're waiting on a little bit of kind of confirmation from CDPHE, but 24 hours symptom free. So that would mean, kind of depending on when that person's symptoms resolved, that if they fit all of the other pieces of that return to learn criteria, they hit that last square, we want to see symptoms resolved for 24 hours before that person returns to school.
So in that example, it would be Tuesday that they would return. Anybody else want to just review the 24-48 piece for folks?
Are getting further clarification from CDPHE on that, because that is something that is, I think, funny to follow.
Okay.
Thank you. We have a situation question in the chat. So person A is at a small gathering on Saturday with person B. On Sunday, B finds out a coworker C tested positive the previous Thursday. A and C have not had any contact. So A is not a close contact, but B would be. Is that correct?
I gotta read this, okay?
Sorry.
Listen to it. Okay, A is at a small gathering Sunday. B finds out A and C have not, A and C are not close contacts. B, so is the coworker like an office mate? If it's just a coworker and they like work down the hall, they may not be a close contact. But if they work in the same office, then they would be a close contact. B would have to quarantine, and A does not.
Thank you. Does that look like it answers it, Allison?
Yes, and Wayne said thank you, so we're good.
Okay.
A question about the minor symptoms. Are temperatures less than 100.4 considered a minor symptom?
I don't believe so.
They're not even on the list.
But feeling feverish is, so if the child is feeling feverish, even, or the person in question is feeling feverish, even without a measured fever, that would qualify as a major symptom. Correct, Soda.
No, that's correct. It's lower fevers are not on the minor symptoms. We're feeling feverish is on a major symptom.
Okay, let's see. Question from earlier on, I believe this has to do with the return to learn. So if a student has a negative test and still has symptoms, it says to follow illness policies. And right now, how sick is too sick has them out for 10 days. Are we saying to follow this or no? Let me know if you need me to reread that.
I might need to hear it again, but I think I saw that question earlier, and I think at least one big piece of it is that as of now, that return to learn document is as saying 24 hours of symptoms resolved. And so if somebody is still symptomatic, that screen would keep them out.
So, oh, go ahead, Taylor.
I was going to say, I think that the differentiation of illness policies in particular is about things like vomiting or diarrhea, that your school probably has their own timeline for those symptoms about how long that has to be resolved. So that additional piece there is still they have to be symptom free for 24 hours. But if there's additional standards that have to be met for a particular symptom, that you should follow those policies.
And just to clarify, because I've seen this a couple of times now in the question, if somebody still has symptoms but a negative test, they cannot return, correct?
Unless those symptoms are a chronic illness that is not above their baseline.
Okay.
Students should not go to school, and no one should go to school with symptoms, unless anybody has a different interpretation than me.
No, I believe that is correct. So that negative test isn't just sort of a absolute if those symptoms are still persisting on that return to learn in level, safer at home levels 1 and 2.
Right, and the negative test is really, it's negative for COVID. I mean, you might have something else that you could give to your coworkers and fellow students. And so if you're sick, stay home.
I'm seeing a version of a question that's popped up a few times that I'd like to speak to. Is that okay?
Yeah, just read out the question.
Yeah, so the most recent question: has communication gone out to providers regarding the timeline of testing 5 days after symptoms present? And so I just want us to kind of pause on that. So it's, we are saying that the best time to get tested after a known exposure is 7 or 8 days, but if someone has an exposure and symptoms develop, they should go get tested at that time. And so we don't want someone waiting for 5 to 7 days while symptomatic to go get tested. That's for someone who had a known exposure, they're in quarantine. Day 7 is a really good day to go get tested if they're not developing any symptoms.
Thank you for clarifying that, Rachel.
Yeah, exactly. I missed saying that. I wanted to also mention types of tests. So the best test to take is a PCR test. They're called nucleic acid amplification test, or PCR, and those are the ones that are the most reliable. If you have an antigen test, if it's positive, we will likely pay attention to that, but if it's negative, we won't. Antibody tests are not telling us much, and part of that is because they can be very, very unreliable. So even if they're 95% specific, you can have about 50% of those tests be falsely positive. So don't do an antibody test.
Thank you for that, Soda.
A clarification question, Rachel, for talking about the timing of testing. If someone has no known exposure, but they have symptoms, how soon should they test?
If they have symptoms, that's a good time to go get that test, especially if they're trying to kind of go down that return to learn flow. If you have symptoms that are present, that's a good time to get a test.
Okay, question. For the 10-day home isolation for symptoms, do all symptoms have to be resolved before returning, or just improving and fever-free for 24 hours? Anybody want to answer that?
I know one piece I usually talk through with folks, but I'll defer to Soda to add anything on, is that we want to see definitely fever-free 24 hours without the use of fever-reducing medication, and symptoms improving or improve, but we really want to see someone who's not like waking up each day feeling kind of up and down. We want to see like significant improvement. As far as, so when we're just talking about isolation for someone who's confirmed, we usually define it that way. I don't know if there are additional things added for school for that 24 hours, but generally for someone to meet that recovery criteria, we want to see 10 days and kind of significant improvement in symptoms plus that fever-free piece. But so to add anything that seems relevant.
So when, especially when people have COVID, there's a subgroup of people, and I don't know what all of their risk factors might be, but some of these people stay feeling kind of sick for longer than their 10-day isolation. And there's no known evidence that viable virus is being spewed out from them past the 10-day mark, but people have side effects that can last a long time past that 10-day mark. So we want their symptoms to be improving. We want them to be fever-free, but they may not be symptom-free past that 10-day mark after their onset of symptoms or after their test result.
Thank you. Okay, another question going back in the chat. I believe this was during the what happens to the contacts. Wouldn't a person who has had close contact with a COVID-19 positive person have screened out and not be at school anyway? Ideally, yes. Taylor, did you want to address that? I saw you unmute.
Yeah, that most likely the scenario that would be is in that really close window. So say on Monday, student A attends school, student A and B both attend school, their siblings or whatever it is. And then somebody gets a positive test result on Tuesday, or sorry, has maybe has a positive test result a couple days later on Wednesday, but they attended schools 2 days previous. Anybody in that time period would be considered a close contact. So it's about that window between the test or symptom onset, that the time before anybody might be suspecting them. So that's where you're really going to have that happen, where somebody's going to be a contact and they were still following the best guidance, if that helps clarify a little bit. Soda probably has more to add.
I think probably all of us who do case investigations have found that not everyone's close contacts are disclosed to the person who's doing the case investigation. There are often times when people will actually refuse to give contact information. And so in some of those instances, they may have notified some of their close contacts and some of their moms of their close contacts, but they may not have disclosed that to the case investigator. So, so when you have things like that pop up, definitely think about giving public health a call. We can help to verify, play it on the safe side. If you're a school and you receive a call like that, go ahead and quarantine the individual until we can figure some of that out.
Thank you.
A question about the 10-day home isolation for symptoms. When a child is required to follow the home isolation, are all members of the child's family required to do so, or only that particular child?
So my initial thought on that is that if someone's following home isolation, they are not a close contact of someone who's tested positive, and they're just having like that one minor symptom or something that doesn't qualify them as a probable case. I think that that child's family would be able to kind of continue regular practice unless something changed. But if that young person is deemed to be a probable case, then everyone who is in that household would be required to quarantine. So it's not the same isolation guidance, but they would have to follow quarantine. But that's a good question if anybody wants to add.
Any other additions? All right, we've got a clarification question as well. I'm guessing maybe this person joined after Rachel, you had gone through the return to learn. But during Safer at Home Level 2, does a person need both a negative PCR test result and an alternative diagnosis, or a negative PCR or an alternative diagnosis? The Safer at Home Level 2 chart does not mention an alternative diagnosis. Can you just run through that one again?
Yeah, absolutely. So for Safer at Home 2, we need to have that negative PCR. So an alternative diagnosis is great, but for that flow chart as it stands right now, we have to see the negative PCR. So unfortunately, it's not one or the other. We're going to need that negative PCR. If they get an alternative diagnosis, great, but we'll still need the test result.
Okay, and that one, just to clarify, is no longer requiring the negative test plus the alternative diagnosis. That negative test could suffice. Okay. All right, Allison, did you have another question?
Yeah, a question. It seems reasonable that people would stay home if they have a COVID test result pending, but I can't find anywhere where it says you should not attend school or work during that window. Worrying about symptoms resolving in that 24 to 48 period, but people returning before they have their test results in hand. Could you talk a little bit through how you would suggest folks act when they have a COVID test result pending, and where we can point folks to for that direction?
Right. There is no guidance that says people who are pending a COVID PCR test should stay at home. However, if a person had a known contact and they've gone to go get COVID testing, if they had a known close contact, they should be staying at home. We may not have discovered them as a close contact, but they should be staying at home until that test result comes back. And even after, because we don't know whether they've tested in a time frame that would have been reasonable to catch a positive. Some people will test positive quite late in their incubation period. It takes up to 14 days to come down with a positive test. So no, there's nothing that says that people who are just randomly going off and getting a COVID test should stay at home while they're waiting for their results. But if people are doing a test because they have a known close contact, they should be staying at home. They should be staying at home for 14 days, whether or not their test comes back positive.
Thank you, Soda. Anything to add from anyone else on that one?
I think that I saw another question in here about will public health be talking to you all about that 14 versus 24 quarantine day piece, and I think that's all kind of comes together with like the more information that we are able to you're able to share with us and we're able to share with you, and the more we have that streamlined, the quicker we'll be able to get that information to you, because as Soda pointed out before, sometimes we have people who refuse to give us their contacts, so we can't inform people who are close contact that they have to quarantine. So the more that we can work together and the more that we can encourage messaging out to staff and students and family members to be working in collaboration with us, the higher likelihood we have of making sure that everybody who should be quarantining is getting that information. So to answer the question here about 14 versus 24 days, if we know of somebody, we will communicate it to you all and give you that return to school date to try and be as clear and transparent as possible. And same goes the other way. If you hear of somebody who should be in quarantine but doesn't know or hasn't received contact, pass that information along to us.
Okay, it looks like we got a follow-up on the awaiting test results question. So what if they're doing a test just because a parent is having symptoms, so the child is asymptomatic with a test pending? Are we presuming the parent has COVID? I think this has been a pretty common question. You know, what if a parent in a household is sick but not confirmed COVID? Should we still send kids to school? What would we like to share on that piece?
People can add on to this. So if a parent knows they have had contact, but the kid has not had contact, the parent is doing a test, the kid is doing a test too. If the kid did not have close contact, the parent should stay at home, the kid can come to school. If the parent is symptomatic and have a close contact, the kid should not come to school. If there's no known contact and the parent is just having symptoms and wondering if this is COVID and there's no risk that we know of or they know of about having had contact, the kid can come to school. Unless if the parent's test comes back positive, then the kid's coming back home. We don't presume anyone has COVID because still the vast majority of people who are testing negative, and we don't have such amounts of high transmission that we're thinking that everybody is going to be coming up positive on a COVID test.
Thank you, Soda. Anything else to add?
Yeah, I think all of those pieces, and something that I think this has come up in another question too, that we find really helpful when talking to folks around contacts of a contact. So if we don't quarantine the contact of a contact. So if you have a household where a parent is quarantining because they had an exposure, what we'll advise to that parent is that your children are able to continue going to school unless something changes. So unless they develop symptoms and or have a positive test. And so that was the big thing that stood out for me in that question too, is if that parent had an exposure, then definitely keep everybody home. But as we start to enter cold and flu season and all of those things, if there's no known contact, and that parent is just getting tested, then at this time we wouldn't be keeping that child home.
Thank you. And there was a question that Soda answered in the chat. Just want to make sure everybody heard that we are checking with CDPHE on that piece in the return to learn about remaining symptom-free for 24 hours. So we do have a question in to the state on that, and we'll be getting more clarification on what exactly that means.
So I want to answer Tracy Sutton's question. Is a rapid test the same as a PCR test? And so there are two kinds of rapid tests. One of them is called an antigen test, which is a test for the little proteins that are on the virus. And it is a direct test of whether the virus is there or not, but it is not as sensitive as a PCR test. So if somebody is doing an antigen test, a positive, we will consider somebody with a positive as maybe they're probable, we might be calling them. If they have, there are other kinds of rapid tests that are also PCR rapid tests, and those are also nucleic acid tests. They are fast PCR tests. And so we take those tests as confirmation of infection. So you kind of have to like ask whoever's doing your test, what kind of test is this? Oftentimes the antigen tests may or may not be a nasal test or a spit test. The PCR tests are generally something up your nose.
All right, thank you, Soda. I think that's helpful. Did you have another one, Allison?
Yeah, a question about the, in what happens to the contacts, they talk about a contact tracing drill. Wondering if we have any thoughts on what that could involve, or if that's something we're still working out.
So we are checking in with our Metro Regional public health partners to see, and with the state to see if there are templates, if there are specific checklists for this drill, just to see if something is already developed that we can also use in Boulder County. But that is a piece that I believe we are still working on. But it would be going through a drill as if someone was positive and tracing through where they sat, seating charts, going through that checklist that Taylor went through earlier to see if it's something that is manageable. But as far as the specifics, we are waiting on a bit more information about that. I did get a question message to me, and trying to remember which document this might be linked to, which tool specifically, but in looking at, I think it's what happens to the contacts or return to learn, or maybe both. So when looking at whether someone has symptoms, let's just say a student has symptoms, if they have that one major symptom that resolves in 24 hours, do they also need to wait an additional 24 hours? Does the symptom need to stay resolved, or is it only linked to that 48-hour minor symptoms that need to stay resolved in an additional 24 hours?
That needs to stay resolved for 24 hours, even if it is, no matter what the symptom is.
Okay.
So when we, the 24-hour and the 48-hour at the beginning of the box is for how long do the symptoms before they're resolved, and then the additional 24 hours. So in some cases, you could see up to 72 hours if a student's symptoms resolve just under that 48-hour cusp, and then they have to wait another 24 hours.
Okay. So whether or not it's major or minor symptom, it needs to stay resolved for 24 hours before returning.
Yes.
And again, that is an area where we're just making sure that the interpretation is, we're interpreting as it's written, and that that's what CDPHE is asking. So we will get back on that piece. But I wanted to ask that question too.
A variation of a question that was asked previously. What about loss of taste or smell and a negative COVID test? Would that be a 10-day exclusion? What would that look like?
Who wants to take that one?
This is also something that we've asked for some more clarity around, some language around it from CDPHE, so we will pass that along when we get it. But as of now, the understanding is that it doesn't matter how long loss of taste or smell persists. If it is unaffiliated with congestion, the student will be out for 10 calendar days, regardless of a negative PCR test. That's unless Rachel or Soda, either of you have anything to add.
No, that is our understanding too.
And oh, sorry.
Oh, go ahead.
And on additional talking points, one of the things that CDPHE is hopefully going to share are some just some good like research points and some evidence points on where kind of their reasoning behind elevating that critical symptom. And so as soon as we have that stuff, we'll share it.
All right. Anything else that we are not seeing in the chat? If you did ask something in the chat that you feel like hasn't been addressed, please put that in now. We are capturing these questions, and our goal is to have a typed up document so you can have these all in one place for review. And again, this presentation is being recorded, so you'll be able to go back and watch pieces that you may have missed.
And remember, this is still going to be a document in progress, because expect that there's going to be changes again. I mean, I hate to say it, but that's something that CDPHE has been warning us about, that as new data come in, some of this guidance is going to change again. Sorry.
And there are QR codes on all of the documents that'll take you to a link to provide feedback. So to Soda's point, they will be looking at feedback, seeing how this works. Today is day 1 of using this guidance as the updated guidance. So we anticipate, as was just shared, that we'll see some changes as we go along. Got a couple of questions about an EPI update for today. I know we did end up canceling our small, our private and charter school meeting today. And typically you all get that EPI review in the morning. So we are going to email that out to the group as well. Okay, let's see. So this is for Soda's follow-up with CDPHE in regards to the 24-hour symptoms. We have numerous kids that wake up with a headache, spend the day at home, and are fine the next day. We would hate to see them have to stay home for an additional 24 hours. The 24-hour minor symptoms thing is common. So I think that maybe is just a note to take back as we discuss what this means.
We can certainly bring these kinds of things up with CDPHE, but for now, you have to be symptom-free for 24 hours. And I think for those of us who've done case investigations, you know, one of the things that we have seen is headache, not generally short duration headaches, but we've definitely seen that. So, and we've definitely seen things like lost their taste and smell for 48 hours. And yeah, the symptom range is all over the place. And so one of the things that happens is there's no pediatrician and no infectious disease doc that can look at some of these symptoms and say for sure that somebody has COVID. The critical symptom is really one of those things that seems to be pathognomic in not quite half of the cases, but it's something that is really noticeable because all of a sudden you're drinking your Starbucks coffee and it tastes like water. So but yeah, we're bringing some of these things up to CDPHE, and every one of those tools has a QR code where you can go ahead and send in nicely phrased comments, you know. So yeah, because I think that these are complicated. So so yeah, definitely give them feedback, and we'll be giving them feedback, your feedback as well.
Great. So we're going to go ahead and end it there. I know there's probably many questions lingering as you all have started to dive into these new updated tools. Feel free to reach out, email us at education@bouldercounty.org. As you're navigating the tools, as always, our EPI support team will be available in the event that you have a COVID case in your setting or a suspected COVID case, or you need to talk through what do I do? What are the next steps here? So thank you all very much for today. And again, we will send out this recording and some written responses to our questions. All right, everyone, have a great day.